6 months ago, Dr. Bobby Mukkamala underwent brain surgery to remove a tumor. Next month, he becomes president of the American Medical Association. Dr. Mukkamala will lead that important national organization from his base here in Flint. Mid-Michigan Now's Courtney Bennett sat down with him this afternoon as he gets ready to embark on the new adventure. Courtney, what does leading the AMA entail?
The American Medical Association's goal is to promote the science and art of medicine and look to better public health. Dr. Mukkamala tells me he's been a doctor for 25 years and now can say he has a better understanding of the patient side, which will help him in his new role as AMA president.
A lot of people know that I had brain cancer diagnosed in November and then surgery in December.
Dr. Bobby Mukkamala specializes in head and neck surgery. 6 months ago, he wasn't the doctor in the room. He was a patient undergoing brain surgery.
It's such a unique experience compared to other people in my hometown of Flint. You know, I think about the challenges they would have to get the same health care that I got in a timely fashion and something they could afford from some of the world's best neurosurgeons in my case. And it's just such a challenge.
He says seeing that firsthand helped him realize there's a healthcare gap in our country. And as president of the AMA, he hopes to change that.
When you go to this hospital or this doctor, you have to type all your stuff out or fill out a form and paper and a pen just to let them know what medications you're on and what allergies you have. And then you go see another doctor a week later and you got to do the exact same thing because that interoperability isn't there.
He's a well-known physician in Flint. His parents, also doctors. They moved to the United States from India when they were 25 years old and started their residency at Hurley Medical Center.
She would drop my sister and I off at the front of the hospital, which is now the emergency department, but it used to be a nice park. And my sister and I would go on the swings and the slides and all that at the park where she would go into the hospital and see her patients.
After his mother was done, they'd go home. Now, every Thursday, Dr. Mukkamala is in that very hospital.
Yesterday morning, I had 11 surgeries there, and so now I'm walking in a little bit more serious, not having as much fun operating on kids and adults there as an otolaryngologist, but the same hospital that I played on the playground when I was a kid.
Dr. Mukkamala and his wife share a private practice, something he says has become very rare.
I mean, it's like 30% of physicians now, and it used to be like 70%. And that's something that I really would like to work on because I think patients just love it more when they park 20 feet from the door to the office, they walk in, they see the same person every time.
With more than 2 decades of experience in countless patients, Dr. Mukkamala says he didn't imagine he'd be the president of a national organization. He actually wanted to be a journalist.
I was like, I want to be like Peter Jennings. And so I told my parents, I think I'm going to become a journalist. And basically they grounded me until I convinced them that, okay, I'll go to medical school.
He did a 7-year program through the University of Michigan.
It's just wonderful that they pushed me to do this because now I thoroughly enjoy it.
And he's looking forward to enjoying this next year as president of a national organization.
It's just been an amazing experience for 25 years of medical practice, 6 months of being a patient. These are all in my experience, because this is a grade 2 brain cancer. These are bonus days in a bonus year.
Dr. Mukkamala will give his AMA inauguration speech on June 10th. For now, live in the studio, Courtney Bennett in Michigan Now.